Hi, I'm Dr. David Warwick of Warwick Chiropractic in Lacey Olympia, Washington. And we have David here. David was doing what a lot of people do, including myself. We lift heavy. We lift heavier, don't at all. We hurt ourselves. You did a good job on this one, didn't you?
Yes, I did.
So go heavy or go home is usually the philosophy. And when we use those freestyle weights and that, it's a good chance we're going to knock our lower back or knock a disc out of position and create some bulging herniation on that. He felt the pop in the lower back, and we've worked on it now for a few visits, at least 3, maybe even 4 visits. And I had him seeing a primary doc as well as hopefully taking some muscle. Are you taking muscle relaxers now a little bit?
I'm
Did they didn't prescribe any?
naproxen. And how was it?
They were using something else.
Vicodin at night.
Okay, the Vicodin's helping you relax a little bit more, taking that down. So sometimes we even need a little bit help depending on how bad you injure yourself. But when you combine multiple modalities, very effective. So I'm going to take you through. We've got a good pinching of that nerve coming out of, looks like maybe L4, L5, but I'm thinking more L5, S1, going down to the back of the leg and to the side, or are you getting on the side right here?
There.
Side right here. Complete numbness and paresthesia on this side. Can you feel when I do this motion right here? Did you feel that?
I did feel that.
Okay.
On the calf, it's I feel that.
Right here. Do you feel that?
I feel when you start, and
Then it disappears. So what happens is that nerve pattern that's going on, that nerve is talking to a certain pattern in the skin. So now we're going to be looking and working with those lower back nerves and get the pressure off them. I'm sure there's more than one. So we've gotten a really good start. He's moving, he's bending a little bit more, getting more motion back again. So let's start out. I want you to start with raising, David, your right leg. Don't bend the knee. Back down. Try the other one. Okay, noticeable difference. So this is primarily a sacral check, and there's a lot of grouping of nerves that come out of there. Exactly 10 pair of group of nerves that branch out that can affect down even into the lower back at the L5 area. So you saw the difference in his ability to raise or not raise that leg, quite significant. So I'm going to help bring that sacrum bone over a bit. Can you try raising that leg, right leg? Significantly better. So he was pretty locked up. No more going heavy, go home for you. So I'm adjusting the sacral apex to the side. I'm using a drop piece right here. Can you raise that right leg for me? I mean, significant difference already. So he's definitely responding. I'm hoping he doesn't have to go for the MRI, but I think we should get it anyways. Do you feel the difference in?
yes.
Yeah. Can you put your right hand on your lower back? So we're going to test L5. I don't see a big difference or a change right there. I'm going to bring it into position 2. Nothing. Nothing. Just a little bit where one leg goes a little bit further. Hand down. So we're going to actually adjust the spinous right here. All right, go ahead. Left hand lower back for me. Right leg goes short. Goes longer. All right, hand down. Let's have you lay on your left hip for me. Okay, top leg right there. Good. Let me do the work. Okay, I'll go easy with you here. So we're right at L4. Let's go the opposite direction for me. So we can either push or pull the vertebrae. Not a lot of release into that area. This was the bit side last time that helped with him. Open that joint up. That was it. That was even more movement than last time.
Good.
Face down. Okay, go ahead, raise that right leg for me. Big difference. So the communication happens to the leg, happens to the nerves, down to the muscles to create that motion or movement in there. Chiropractors can do it in many different ways of assessing it. You can feel for loss of the motion, you can feel for heat, you can do muscle testing. We just want to check that space. We can test by having the patient actually do certain movements to see whether we can even push into the area of correction or into misalignment. So I'm going to begin with some of the traction with him. Open up that joint space and help some of that disc get off that nerve in that position right there. You okay, David? Is that too much?
Nope.
So each visit that he was coming in, the first couple of visits, there wasn't a lot of movement in there. There was so much swelling. And here's what happens. When you guys get injured out there, scar tissue starts to lay down on day 3. It's already laying its foundation. That's what makes it so difficult. And you have, even in 3 weeks period of time, a significant amount of change to where that initial injury happens. You have to be pretty responsive within that first day it happens, to 3 days, or even up to 3 weeks. And that's what we show, that you want to reduce that scarring and the misalignment from being, I don't want to say more permanent, but I want to say holding that abnormal position. All right. Do a little bit of massage in there. You okay?
Yes.
So I'm working on the quadratus lumborum muscle right here to get that relaxed, a little more on that side. Did you notice how the treatment was a little different this time than last time?
Yes.
Yeah, we're definitely pinpointing that. We'll work on the piriformis right here, IT band. I'm going to slowly bring it back to the middle here. Good. You okay? Yeah, it's vibrating the lungs a little bit on there. Gives you like that cough, that tickle cough almost. Yep. We use that type of massager to bring a lot of blood to the area. Obviously, it can act as healing to the tissue, push out the swelling in there. Bring it up just a little bit more. I'm going to stop it in that position. I want you to take a few deep breaths in and relax it out. Good. Okay, let's bring this down. All right, lay on your back, please. Too deep of a stretch?
No, it's actually really good.
Okay, we're gonna cross the arm right here. Breath in. And so what happens when people have, like David has, where there's a disc involvement, people tend to lean to the side. All of a sudden you start getting that spasm and kink going up the back. I don't have to tell you, you know the muscles connect up the bottom. Well, it starts stressing that and people start feeling in their mid-back. That's just a secondary problem in there. Just because you're leaning to the side. You look like you were standing straighter and moving better when you came in. So I like to check the knees and the feet. Not going too hard because that area is still a lot of swelling, a lot of pain around that area. I do a neck adjustment just because that helps with, one, his posture, but also helps with the relationship of the misalignment in the lower back. So I'm adjusting in the upper cervical. Good. Sorry, that was a little bit harder. Can you try raising this leg up for me, the left one to start? Back down. Can you try the other one? Pain there. Yeah, still, but you're bringing it up. You
Yes.
brought it up further than before, so the strength is starting to come back to it. Are you feeling the paresthesia or numbness tingling there? Right
Just
now?
in the foot.
Just in the foot right now.
Yeah, just in the.
So not in the thigh right now.
No, it's pain in the
A little
thigh.
bit?
No, but not numbness.
Okay, all right. Any questions?
No.
Awesome.
I don't think
All
so.
right, I'm Dr. David Warwick of Warwick Chiropractic in Lacey Olympia, Washington. If you are suffering with leg pain, sciatica, or having numbness and tingling, especially down the legs, give our office a call, see if I can help. And a lot of times it could be a pinched nerve. Look at my tips on my website. There's some things that you can do on your own. The icing, the roller, sleeping at night, various tips. So I have tips 1 through 9 right now that you can start to review and do on your own. If you're not getting help by doing things on your own, give us a call.